Hi guys, in today's video I'm going to be sharing with you my injection techniques when doing frown, forehead, gummy smile, brow lift, and lip flip Botox. Hi guys, today I'm going to be injecting my lovely model Tara, and today we're going to be doing some frown toxin, forehead, gummy smile, and lip flip, as well as a brow lift. First, we're going to look at her. She's fairly young, but she does have a strong frown. Can you frown for us, please? So if you look here, her frown is quite strong. So I'm gonna go ahead and do 25 units. I'm using Dysport today. And then you're gonna have them raise their brows all the way up. And her forehead lines aren't so bad. The muscle strength of her frontalis isn't too intense. So I'm just gonna do 6 units up there. And her main concern as well was the frown and the fact that she was starting to have a deepening line. And then her other concern was her slight gummy smile. Give us a big smile. So her gummy smile isn't really too bad at all. So I'm just gonna do 2 units on either side. And then we're going to do a lip flip as well. Now she's an ideal candidate for a lip flip because as you notice, as soon as she smiles, her top lip kind of curls inwards. And whenever I see someone like that, I'm like, okay, yes, a lip flip would look great on you and it's gonna give you a more drastic change versus certain other people. So I start by cleaning the area off with some chlorhexidine. I'm gonna start with the frown. So I'm gonna be doing 7 in the procerus, and then 7 and 7, and then in the corrugator tails, I'm gonna do 2 and 2. Okay, give me a strong frown, and relax. We're injecting in the bulk of the muscle, a little poke. This is her first time getting any type of injection, so it's really exciting. How was it?
That was fine.
Yeah?
I hate needles. So.
That's good. Frown again, and relax. Again, going into the bulk of the muscle, injecting 7 units, and another frown, and relax, and another poke. Perfect. Now the amount of units you're going to put is going to vary obviously based on the person, and it has nothing to do with wrinkling, it has more so to do with muscle strength. So a lot of clients, they'll come in and they'll be like, oh, I don't think I need much, I'm not too wrinkled, but it has nothing to do with the wrinkling actually. And frown again, and relax. So I always get them to animate, and I inject in the bulk of the muscle. And then frown one more time. So you can see the pull of the corrugator tail right here. You wanna make sure that your injection is inside that pull. So it's inside that bulk, and it's not before that crease, because if you go before that crease, you might risk getting a ptosis. So give me a frown and relax. So you should always be asking your patient to animate for you. Now for the forehead, I like to mark it up with a pencil so that I get an even distribution of my toxin. So I just use a marking pencil. I get her to raise her brows all the way up and keep them there for me. Up again. You want to be sure to go lateral enough. Raise again. So we're doing 6 units up there. Don't be scared to go lateral. When people don't inject more laterally, that's when we get the Spock brows that really drive me crazy. And yeah, no, it's annoying because in training schools, they teach you to stay more medial, but then you have that issue of running a Spock. And the reason why they teach you to go more medial is to prevent a drop. But in order to prevent a drop, you can just dose appropriately and keep your injections high enough. Her forehead is short, so this is as low as I would ever go. And now that I have my markings, I don't need to ask her to animate every 5 seconds. And I'm just doing 1 unit. With the forehead injections, you really want to be as specific as possible. Like, obviously with any of the injections, you want to be specific and precise, but especially with the forehead, because that's the main area where it's going to show, with the brows being uneven and stuff like that. Another way you have to be really specific in the forehead is with the amount of units in your syringe. You don't want to have any bubbles whatsoever. Just apply some pressure if there's some bleeding. And again, if at the 2-week mark, the brows are kind of uneven or there's any concern regarding the appearance of things, the forehead is where you're going to correct majority of that. Okay, now we're gonna move on to a brow lift. So with the brow lift, I always ask the patient to look at themselves in the mirror and tell me where they like the lift. So do you like it more lateral or more medial?
Like, I guess like that.
Okay, perfect. And the reason being is the muscle is circular, the orbicularis oculi. So we're relaxing it so that we get, wherever we relax it, that's where we're going to get the pull and that lift. She wants it less lateral, a little bit more medial, but not super medial. So we're gonna inject right in the brow. Again, this is another area where you wanna be as precise as possible. I'm grabbing it just because it is a delicate area. You don't wanna just inject without holding it. And then I'm gonna come on the other side and do the same thing. How are you doing? Okay, now I'm just gonna reconstitute my toxin. I do a 1.1 milliliter dose per 100 unit. The 0.1 is just to account for anything that's left in the hub of the syringe. So it's really 1 milliliter that's actually going into the vial. And we're using this board today. I just give it a little swirl. And then I decap it with just some scissors. Okay, so now we're gonna move on to her lower face. We're not gonna do any crow's feet. Typically in younger people, if they don't have static lines, I just don't feel the need to do their crows because it's gonna take away from expression at a certain age if you get it done too young, I think. So we're gonna move on to her lower face. We're gonna inject in here for the gummy smile and we're gonna do the lip flip. So I applied a little bit of numbing cream just because it is her first time getting any type of injection. I wanna make it as comfortable as possible, but most people typically get it done without. So I'm just gonna wipe off the excess. I'm gonna start with the gummy smile injection. And basically we're gonna be injecting into a muscle that pulls upwards when you smile to relax it so that it doesn't pull as much anymore. And I'm doing 2 units on either side. Hers aren't bad at all. And you're going right into a 90-degree angle, just like that. Two units here, and 2 units right there. So that's it for that. It's about a centimeter away from the nose. And now moving on to the lip flip. My lip flip formula is a little bit unique. I don't know anyone else that does it this way, and I think it gives the best result. Because typically the lip is tighter in here, I put more units on the outside, fewer units in the middle. So I'm gonna do 2 units out here, 1 unit at the Cupid's bow peak, and then 2 units on the corner, because that's where most of the pull is coming from. So I'm gonna tot and a little poke. And it's just right at the vermilion border. Now we're gonna do the peak here, a little pinchy. This is a little pinchier, eh?
Yeah.
2 more pokes. And then 1 poke here. And last poke. There we go. And now we're gonna clean her up, and that's it for the injections. Okay, so we are done the injections now. It only takes a few minutes. So the toxin's not gonna kick in. Most people start to notice within day 2 or 3, it start to kick in. And then at the 7-day mark is where most people feel like it's in full effect. But if you're gonna do any corrections, it's important to wait till at least the 10 to 14-day mark just to make sure that it is fully kicked in. Some people, their toxin doesn't kick in as early, so don't be alarmed. Always wait till that 2-week mark, and then you can always add more You can't remove more. So if you want to be more conservative about it, you can dose a little lower. I find that a lot of injectors dose a little bit too low sometimes, and then that compromises the longevity of the toxin. So you want to make sure that you dose appropriately for the muscle strength. So we did 47 units in total.